Hey there, welcome back to the channel. Tons of people around the world have trouble sleeping, and pretty much everyone will experience at least one period of poor sleep during their life. However, when poor sleep begins to interfere with daily activity, that's when poor sleep can become a sleep disorder. So today I'm going to give a general overview of the four most common types of sleep disorders, so let's get into it. Hey everyone, my name is Matthew, and welcome to Calm Insomniac, where we're a community of people trying to get a better night's sleep. If you're new here, please like, subscribe, and hit the bell icon for notifications. Poor sleep and sleep deprivation is a huge problem. According to a study done by the CDC, 50 to 70 million Americans suffer from a sleep disorder or sleep deprivation. On top of that, 23% reported difficulty concentrating during the day, 11% reported tiredness affecting their ability to drive, and another 9% saying that tiredness impacted their daily job. Sleeping poorly and being tired all the time really can affect your overall health and safety and just your ability to function day to day. But when it becomes a problem that it's consistently interfering with your life, you may have a sleep disorder. Now, before we go any further into discussing the sleep disorders and their causes, symptoms, I need to give a big, huge disclaimer, and that is, I am not a medical professional, and this is not medical advice. If you have any concerns regarding your health, please contact your doctor or healthcare provider. Alright, with that taken care of, let's talk about the four most common sleep disorders, and those are insomnia, sleep apnea, restless leg syndrome, and narcolepsy. Now let's begin by talking about insomnia. Insomnia has kind of become a catch-all term for just not being able to sleep, but it can be an actual sleep disorder. Some of the symptoms of insomnia are the ones you're probably already thinking of, and that is having trouble falling asleep, having trouble staying asleep, and feeling tired when you wake up. But there are other symptoms that could be connected with insomnia, and those include daytime tiredness, increased anxiety, and continuous worry about your ability to sleep. There are actually two types of insomnia, acute and chronic. Acute insomnia is something that most people will experience at least once in their life, and it lasts for a relatively short duration, usually less than a month, and it's related to some outside stressor. Extra stress at work, worried about a relationship, a difficult travel schedule. And acute insomnia will usually resolve itself naturally once the stressor is lessened or removed. The other type of insomnia is chronic, and that's a much longer lasting insomnia, usually lasting more than 1 month. Chronic insomnia can also be due to an external stress. However, it can also be related to a poor lifestyle choice, such as not eating well or not exercising enough. Also note that acute insomnia can become chronic insomnia if it passes that about 1 month mark. Something else to know is that chronic insomnia can be an additional side effect or byproduct of one of the other sleep disorders that we'll talk about later. If you have insomnia and you speak to your doctor, it's possible that they'll give you a medication, but it's more likely that, at least at first, they will want to do more natural relaxation methods. They might suggest you try meditation or yoga, changing up your diet, but something that can be done naturally without putting any chemicals or drugs into your body. The next sleep disorder we'll discuss is sleep apnea, and this is a potentially dangerous sleep disorder in which you repeatedly start and stop your breathing throughout the night. There are 3 types of sleep apnea: obstructive, central, and complex. Obstructive sleep apnea is when the muscles in your throat relax so much that they temporarily prevent you from breathing. In other words, the muscles relax and that narrows your airway, which then alerts your brain that you're not getting enough oxygen, and it suddenly wakes you up. People with obstructive sleep apnea often wake up gasping for air, and they can also be people that snore very loudly. But please understand, not everyone with sleep apnea snores, and not everyone who snores has sleep apnea. One quick note is that obstructive sleep apnea is the most common type of sleep apnea. Central sleep apnea occurs when the brain fails to send proper signals to the muscles that control breathing. This is a default in your central nervous system, hence the name central sleep apnea. And finally, complex sleep apnea syndrome occurs when someone experiences the symptoms of both obstructive and central sleep apnea. Some of the symptoms of sleep apnea include waking up gasping for air and snoring loudly, as I previously mentioned. Other symptoms can include waking up with a dry mouth, waking up with a headache, and other general symptoms that are like insomnia. Also, if you have a spouse or partner that happens to tell you that they noticed there were periods during the night where you temporarily stop breathing, that's something else to look out for. Aside from sleep apnea preventing you from getting quality sleep, if left untreated, sleep apnea can lead to other health concerns such as high blood pressure, other heart problems, type 2 diabetes, and liver problems. If your sleep apnea is mild enough, your doctor might simply recommend some lifestyle changes. However, most people typically will get a CPAP machine. CPAP, or continuous positive airway pressure machines, are designed to create just enough airflow to keep your airway open during the night. CPAPs usually connect to your nose, and they're pretty quiet and small, and they also make travel-size versions for taking on an airplane. As an additional side note, both of my parents actually have sleep apnea and use CPAP machines, and I know personally that it has really helped their quality of sleep, and I wouldn't be surprised if somewhere in the future I have to use a CPAP machine myself. The next sleep disorder is restless leg syndrome, or RLS. And RLS is a condition where your legs have an uncontrollable urge to move, often due to an uncomfortable sensation in your legs, and moving your legs temporarily relieves that uncomfortable sensation. RLS often occurs and worsens at night, and the reason RLS can be considered a sleep disorder is because if the symptoms of RLS are preventing you from sleeping, that's when it becomes a sleep disorder. There is no known cause of RLS, and anyone can get it at any age, and it usually worsens the older you get. It's difficult to identify the exact sensations that people feel who have RLS. One thing to note, though, is that the sensation occurs inside your leg. It's not surface or skin level only. Some of the sensations people have felt in their legs include throbbing, pulling, crawling, itching, and even electric sensations. If you have RLS, it's possible that it could be treated with some lifestyle adjustments, but it could also be treated with medicine, especially medicine that increases dopamine levels, since dopamine has an effect on the control of our muscles. The last sleep disorder we'll discuss today is narcolepsy, and a lot of people are familiar with narcolepsy, often because in music and television it's portrayed in a sort of comedic light. I can think of several medical shows that have presented narcolepsy in a comedic way, and personally it doesn't bother me, but all jokes aside, narcolepsy is a serious medical condition. Narcolepsy is a chronic sleep condition characterized by overwhelming drowsiness and sudden attacks of falling asleep. The exact cause of narcolepsy is unknown, and there's also no known cure. There are two types of narcolepsy, conveniently labeled Type 1 and Type 2. Type 1 narcolepsy works in conjunction with a condition known as cataplexy. Cataplexy is the sudden loss of muscle tone. This can take the form of your muscles suddenly going weak, but it could also affect other things like causing you to slur your speech. Cataplexy is uncontrollable and often triggered by a very strong emotion. When people imagine someone who is narcoleptic, the results of cataplexy are usually what people think of, such as someone walking down the street and suddenly falling over asleep. And Type 2 narcolepsy is simply narcolepsy without cataplexy. Other symptoms of narcolepsy include trouble staying awake, falling asleep during the day, hallucinations, and changes to your REM sleep, but that one probably has to be identified by a doctor. Also, narcolepsy could be the result of another sleep disorder. Since there is no cure for narcolepsy, lifestyle changes and medicine can help manage the symptoms. There we go. That is a very brief overview of the 4 most common types of sleep disorders, and I've got to say, this was a hard one for me to film because I'm not a medical professional, and this information, while I know it and have written about it, it's still difficult for me. Remember, I'm a musician, I'm an orchestra conductor, so if you check out my videos on music, you'll see that I probably look a lot more comfortable, but this information is really important to share, and I had to fight through it to make sure that I got it out there to you. And remember, if you have any concerns about your sleep and your overall health, please make sure that you talk to your doctor. Don't forget to like, subscribe, follow me on Facebook and Pinterest, and check out my website, calminsomniac.com, where I have a whole bunch of articles on sleep health, sleep tips, classical music, and some product reviews. You can also sign up for my email list where I'll keep you updated on everything I post. Thanks for watching. I'll see you next time.